My name is Ben Umbel. I'm an orthopedic foot and ankle surgeon here at EmergeOrtho.
My name is Dr. Sullivan, Brian Sullivan, and I'm a sports orthopedic surgeon here at EmergeOrthopedics.
Probably important first to know a little bit about the anatomy as far as what muscles make up your calf. So you're generally talking about two muscles, your gastroc and your soleus, or your gastrocnemius is kind of the full name for it, but gastrocnemius and your soleus, and generally talking about tears of the gastrocnemius muscle, which is kind of that bigger muscle that you could see kind of poking out in the top part of your leg there. And a strain is essentially a tear, so there's different degrees as to how severe these can be. It can be as simple as kind of a partial tearing all the way to a more significant tear. And I think it's also probably important to differentiate this from an Achilles tendon rupture, which is a different entity in that these two muscles ultimately make the Achilles tendon as they go closer to the heel, but this is a different type of injury as far as the injury itself and more importantly kind of the ways that we manage it. But a strain is essentially a tear to some degree.
Most commonly, patients that are going to be injured with a calf strain are typically in their 40s, but can affect all age groups. I think the most common symptoms are going to be after an initial burst of speed, whether it be from a seated position or if they're in some sort of sports activity. They're going to feel a pain in the back of the leg, and sometimes people will feel pop, and kind of depending on where that is, they may have immediate pain and symptoms that debilitates them, that really they're unable to continue doing that activity or even walk. And depending on the severity of it, some people may just feel a little bit of a pull or tightness. Depending on the degree of injury, it really kind of depends on the symptoms that the patient experiences.
Essentially, diagnosis for a strain can be as simple as a physical exam finding, so making sure, one, that the Achilles mechanism is intact and we're not dealing with an actual disruption of the Achilles tendon or at the junction where it becomes the muscle versus the tendon. If there's an exam that is kind of equivocal, that's where the role of an MRI or something comes in to better evaluate the quality of that muscle, the extent of the injury, or to rule out an actual Achilles tendon type injury. Again, kind of differentiating between Achilles tendon tears and an actual calf strain, which is more of a muscular injury. You can have injuries to the calf muscle at the junction of where they become the tendon and they become the muscle. And again, that's different from the Achilles tendon rupture, which you at least talk about a surgery, but when you're specifically talking about a calf strain, injury to the muscle belly itself, the treatment for me is non-operative. So unfortunately, there's nothing that you can really get up there and repair from a fixation standpoint. It's usually first and foremost thinking about pain control and edema control. So for the first week or so, you're generally just trying to get people to feel better, get the swelling down, get the pain down. And after that, you start to get people back into more of their normal routine. So it's generally either talking about physical therapy versus physician-directed home exercises. Again, keeping pain, keeping inflammation down, but getting people moving, limiting the amount of scarring that's kind of forming as those muscles are healing, and gradually progressing people back. And it can range anywhere from 4 to 6 weeks till people are probably feeling pretty good after this injury where they can resume most of their normal activities.
Depending on, if it's a grade 1 strain, you're talking, days to weeks potentially. As high as grade 3 strains where you have a fulminant rupture of the muscle belly, that can take months to fully recover. So it really depends on the severity of the injury and where the injury occurs in the muscle.
As a general rule, to stay active, to stay mobile, to stay limber, for lack of better words, is probably the best thing that all of us can do on a day-to-day basis. So the more conditioned you are, or maybe a better way to put it is the less deconditioned you are, is probably the best approach to preventing injury. And certainly as we get a little bit older, that warm-up maybe takes a little bit longer and should be a very important part of getting into activity. It's different when you're a high school athlete where you can wake up and hop right back onto the field or the basketball court and get going and not really have to worry about injury. So I think it's first and foremost staying active, keeping yourself from getting too tight, from becoming deconditioned, and then taking the time that you need to really warm up into an activity, and then doing a cool down. So really kind of stretching and taking your time to kind of recoup from some of these activities that you're doing.
I don't think there's a wrong answer to that question. So I would personally say you're not wrong for seeking out, expert opinion if you have an injury to the calf muscle and you're concerned. This is something that, we can diagnose, we can treat, we can look at it and kind of determine what level of care you need. If you're experiencing any of these symptoms, we'd be happy to see you here in Hickory, North Carolina. That's where we're at. It's where I'm from. So, trying to give back to our community, I think, that's the best way to do it is be in the community. Do you want to show your calf muscles off?
No.
I know you got some good ones.